Hello everyone! Welcome to our channel. On today's episode, I will be discussing about the salary of a registered nurse here in Australia. Have you ever wondered how much does a registered nurse get paid here in Australia? I will be sharing to you how much we get paid here in Australia, specifically in the state of the New South Wales or NSW. Everything that I will be discussing today will be based on the Public Health System Nurses and Midwives Award 2021, and that is when you want to work in the public hospital or in the public health sector, and it will also be based on the New South Wales Nurses and Midwives Association Enterprise Bargaining Agreement from the period 2010 to 2023. The salary that I will be discussing is applicable for those registered nurses in Level 1. What does that mean? Level 1 nurses are those who perform the general nursing duties, or should I say those who are working on the floor. So it means that RN Level 1 does not include those who are clinical nurse specialist, clinical nurse consultant, nurse unit manager, service manager or facility manager, a nurse educator, nurse practitioner, assistant director of nursing, and the director of nursing. So those roles are not included in today's discussion. The salary is applicable to full-time, part-time, and casual employment. One thing to note about is that casual or on-call registered nurses, they do get the same base rate, but they have this casual loading. Depending on the institution or organization, the casual loading can be between 15 to 25%. And the pay rate is also based on the years of experience here in Australia. There are some hospitals or institutions that do recognize prior experiences like those in overseas. Oh my. According to the Public Health System Nurses and Midwives Award 2021, the registered nurse level 1 has 8 pay points. Pay point reflects the number of years of experience, and it has the specific rate of remuneration that is payable to the registered nurse. So there are 8 pay points. So it means that the first pay point, that would be your first, that would be the entry level. Either you have 0 to 1 year experience, pay point 2 if you are on to your second year, pay point 3. Then 4 if you for your 4 years experience, down to pay point 8 if you have 8 years of experience or more. By the way, here in Australia, registered nurses are commonly paid per hour. Without further ado, let's now talk about the salary of a registered nurse here in New South Wales, Australia. So, in the public health sector, the entry level or the pay point 1 for a registered nurse level 1 is $33.13 per hour. Oops! And for those who have 8 years experience or more, then the rate is $46.52 per hour. So between the pay point 1 to pay point 8, the public health sector offers between $33.13 to 46.52 cents per hour. The pay rates that are stated in the public health system Nurses and Midwives Award 2021 are applicable to all nurses who work in different specializations. So it doesn't matter if you work in the theater, if you are an ED nurse, or if you are a pediatric nurse, what else? Family and child nurse, sa mga nurse, oncology nurse, and wherever you work, medical or surgical, you will have the same pay rates because that is what is stated in the Public Health System Award 2021. So it doesn't matter where you work in the hospital. Now, let's move on to the salaries of the registered nurses who work in the residential aged care facilities, either in the not-for-profit organization or in the private organization. For the aged care providers, the most common pay points are from pay point 1 to pay point 5, but there are other organizations who are still offering pay from pay point 1 to pay point 8. If your experience is more than 5 years, your pay rate or base rate will be based on the pay point 5. Even if your experience is 7 years or 8 years, you will still get the pay rate from pay point 5. So, for the registered nurse level 1 who will be working in the aged care, the entry level or pay point 1 is between $23.23 to $36.28. And for those who have 4 years experience in aged care or more, so this one, this pay point is from pay point 4 to pay point 8, then you will get paid between $32.05 to $45.71 per hour. On average, registered nurses in aged care can receive $34.47 per hour. In addition to the base rates that the registered nurses get here in Australia, New South Wales, most of the organizations also offer penalty rates. So what are these penalty rates? If you are working day shift, that would be starting from 7 to 3, you won't get any penalty rates. You will only be paid on the regular rate, and that would be the base rate. But if you will be working afternoon shift, that would be starting from 2 or 3, then you will get an extra 12.5% on top of your base rate. If you will be working night shift, then you will have a penalty rate of 15%. And then if you will be working on Saturdays, you will get a 50% extra on top of your base rate. And then Sunday, you will get a 75% penalty rate. These penalty rates both applies to the public hospital and also to the residential aged care facility. And the only difference is the public holidays. So in the public hospital, and you will get an extra 150% on top of your base rate. Yes, very good. Up and down. Huh? Very good, oy. On the other hand, the aged care providers do offer penalty rates between 150% to 250% if you work on public holidays. The penalty rates for the afternoon, 12.5%, and also night shift, 15%, only applies on weekdays. So that would be from Monday to Friday. If you will be working on Saturdays, the penalty rate for all shifts, that would be the day shift, afternoon, and night, will receive the same penalty rate, 50%. This is also the same on Sundays. So if you work on Sundays, if you work day shift or afternoon shift or night shift on Sundays, then you will get 75% penalty rate. So is the public holidays, you will get 150% to 250%. And one more thing, it's not only the penalty rates that we registered nurses can get. Registered nurses are also paid when they do overtime. In the public hospital, if you work overtime, the first 2 hours will be paid 150%, and it will be paid 200% or double thereafter. The residential aged care facilities, on the other hand, either not-for-profit or private ones, then your overtime will be paid. Most common as well is you will get paid 150% on the first 2 hours, and then double or 200% or thereafter. But there are some residential aged care facilities that offers that pays overtime up to 250%. Oh, I mentioned in my previous video the four common allowances. Yes. In the public health sector, the in-charge allowance is between $36 to $69 per shift. This also depends on the number of beds that you will be handling, either less than 100 beds or more than 100 beds, or if you will only be in charge of the ward or the entire hospital, or altogether ward and the hospital. In a not-for-profit organization or a private residential aged care facility, the in-charge allowance is between $20.28 to $45.06 per shift. The same thing, it depends on the number of beds that you will be handling, either less than 100 or more than 100 beds. For the uniform and laundry allowance, the public health sector offers 39 cents per hour, while the residential aged care, either not-for-profit or private, they offer between 12 cents to 54 cents per hour. The third one is the on-call allowance. The public health offers $3.94 per hour. So if you work an 8-hour shift, that would be equivalent to $31.52 per day that you will get as an on-call nurse. On the other hand, for the residential aged care facility, either not-for-profit or private, you will get between $21.98 to $49.35 per day, and the average would be $35.67. The last allowance that I mentioned in my previous video was the vehicle or the transport allowance. I could not find anything on the public health system Nurses and Midwives Award 2021 about that one. But for the residential aged care facility, not-for-profit and private, they offer 40 cents to 87 cents per kilometer if you are working in the community setting as a nurse. Here in New South Wales, Australia, um, registered nurses also receive yearly increase in salary. In the public health sector, as of 2021, the salary increase is 2.04%. And the percentage of salary increase in the public health sector varies yearly because this is approved by the New South Wales Industrial Relations Commission. So they will approve what the federal government is offering. And for the residential aged care facilities, not for profit or private, the salary increase every year can be between 1.3 to 3.9%. And this will depend on the negotiations between the employer and the union. Before I will end this episode, there is one question. Can a registered nurse live off with the salary here in Australia? I would answer yes, but it will all depend on how you enter the workforce. Everything will depend on the awards and the enterprise bargaining agreement as well. Another thing would be the cost of living here in Australia. So it includes the rent, the food, the transport, fuel, or also the recreation. And it also depends on the location of where you live. So either you live in the city, regional area, or rural areas. So if you live in the city, rent there would be more expensive than living in the regional area or rural area. Another factor would be your lifestyle. So it will also depend how you spend your money. And lastly, the best of all will be the taxes. We are paying taxes here every time we receive our pay every fortnight. Taxes, the employer always have to pay the withholding taxes on our behalf. If you work extra day or two when you are already a full-time registered nurse, then expect that you will also be paying more taxes. In the end, I would say Australia is the best. I have never worked in other countries as a registered nurse, but I am happy where I am now. And maybe because Australia has really offered a lot of benefits for registered nurses, and it's a privilege to be a part of their healthcare industry. So I hope some of you will gonna be encouraged to come here and work in Australia as a registered nurse. I would say a lot of organizations, either in the hospital or in the community setting, in the aged care facilities, we are always, or they are not we, I'm just an employee, they are always looking for registered nurses. And by the way, I did not discuss anything about the private hospital pay or benefits because I did not have that experience. So till next time,